Welcome to today's episode. We will explore a crucial yet often overlooked aspect of mental health care, treatment adherence. When it comes to managing mental health condition, started a treatment plan is only part of the journey. Sticking with therapy medication or lifestyle change over time can be challenging and yet it's one of our most important factors and in achieving long-term well-being. In this episode, we'll dive into what treatment adherence really means, why it matters, and the barriers many people face along the way. And we'll also discuss practical strategies, personal experience, and insights from professionals to better understand how individuals can stay engaged with their care. Whether you are someone navigating your own mental health journey, supporting a loved one, or working in the field, this conversation aims to inform, challenge, and inspire. Let's get started. First of all, I have some special guests here. Could you please introduce yourself one by one, please?
Hello, good morning. My name is Pamela Montilla. I am nursing student. I'm really looking forward to what we're going to discuss in this podcast.
Good morning, my name is Luna Sanchez. I am nursing student and I welcome you to this new episode. Today we are going to explore mental health from a clinical yet human perspective.
Okay.
Hello everyone, my name is Hasblady Alejandra Villarreal Ralón. I am a nursing student and I am looking forward to learning a lot today alongside you all.
The aim of this podcast is to have an open discussion about adherence to mental health treatment and to hear your views on 7 points designed to address key aspects of this issue. Let's start with the first item, which is what the several mental health disorders are you aware of?
Throughout my training, I have had the opportunity to meet and care for patients with various conditions, especially those living with schizophrenia, major depression, and bipolar disorder.
I am familiar with conditions such as schizophrenia, obsessive compulsive disorder, mixed anxiety and depression disorder, bipolar disorder, and hallucinations. I know that this can trigger my many factors that affect is on our daily life or events have experienced side effects.
Well, so far I am aware of some conditions such as schizophrenia, bipolar disorder, and severe depression. I understand that these are serious disorders because they have a major impact on the way a person thinks, feels, behaves. It's not just about being sad or stressed. I actually change a person's life, how they functions in society, and can make it difficult for them to carry out everyday tasks.
Your opinion is very important. There are currently far too many mental health disorders and the statistics are rising steadily. Let's move on to the second item. Do you know of any experience of a patient or family member who has a several mental health disorder or has gone through one?
Yes, in fact, someone close to me is currently suffering from depression and anxiety due to illness they have. This person is receiving psychological and psychiatric care.
Okay.
Yes, I know someone close to me who has schizophrenia. It's been something that has made me see mental health in a different light because sometimes you think it's something that doesn't affect you, but it does. I've seen that there are times when they are doing really well, socializing, and are in good spirits and full of energy, but then from one moment to the next, their mood plummets, or they stop talking, or simply become aggressive. I've also seen them talking to themselves, and they've even attacked one of their relatives.
This topic is very close to my heart. I have a distant how would talk care of my when I was little, and today saddens why me deeply that she doesn't recognize me when she sees me her horny with schizophrenia has been very difficult. There have even been cases where she has gotten lost in the streets.
Okay, it's amazing all the stories we find around us. We'll move to the third term. Based on the previous point, what treatment has the patient you mentioned received?
Okay, as far as I know, he has been treated with medication and has also attended therapy.
Okay.
I also know he has spent periods of between there and 6 months in mental health care institutions.
Okay.
Furthermore, he has had regular checkups with a psychiatrist. I think this is important because it's not just about taking medication, but also about talking, receiving support, understanding what is happening to him, and grasping the context.
Okay.
While I am still deepening my knowledge of pharmacological protocols, I know that she's prescribed risperidone, which is a
Okay.
antipsychotic for managing her symptoms.
Okay.
These conditions have been managed with medication, so they also have sessions with their treating doctor to unburden themselves and monitor their mental and emotional state.
As we heard, it's too necessary to provide a proper treatment. Okay, we'll move to the next item. Do you think that stopping medication have a serious impact of the patient's life?
I truly believe that medication adherence is essential. One way or another, it is what provides the patient with clinical stability
Okay.
and a better quality of life.
Yes, I believe that stopping medication can cause the things and symptoms that were being treated to repair and become much more severe, and well as loss potentially lead to new symptoms or worsening of the condition.
Okay.
Okay, yes, I do think it has a significant impact because medication helps the person to be more stable. So if they stop taking it without medical supervision, their condition may worse or the symptoms may return, leading to a relapse and making the situation more complex. I think this is a sensitive matter that shouldn't be done without professional guidance, and whenever it is done, ideally it should be with the support of family or friends, but with proper authorization and support so that it doesn't backfire.
Okay, it's appropriate and closely monitored trade. It's important. Okay, we'll move off the next item. What factors do you think influence low treatment adherence among mental health patients?
Factors such as a lack on income if they have to buy the medicines, the appearance of symptoms they did not previously have, for example, vomiting, diarrhea, mm, lose the appetite,
Okay.
which make the patient feel unwell. I believe the most common reason is they forget to take the medication or do not have a clear schedule for take it.
Okay. ¿Sí paró?
Okay, I think there are several factors that can influence this. For example, the fear or shame of having a mental health problem and how one will be perceived by others, the side effects of the medication, or the person not fully understanding their condition,
Okay.
or the benefits of treatment for that condition. It also depends on whether they have family support, which is essential for having support throughout the treatment and recovery process.
In my opinion, they are four critical factors. The illness, the presence of anosognosia, lack of insight where the patient does realize they are healed. The medication, side effects like tremors, weight gain, or sedation can be very distressing.
Okay.
The environment, lack of family support, social stigma, and economic barriers to healthcare. And the clinical relationship, a lack of trust or poor communication with the healthcare team.
Okay, as we can see, there are several factors that influence this aspect. Okay, we'll move on the next item. Do you think you could develop a mental health disorder? Which one? Why?
Okay, yes, honestly, I think anyone can go through that. There are situations where our coping abilities can be pushed to the limit. In my case, it could be anxiety or depression
Okay.
due to the stress of university,
Okay.
the responsibilities I have towards my family, in repaying their efforts to support my education, the ever increasing academic demands, and everything one experience day to day.
Okay.
That makes me think that we must take great care of our mental health and let go of the burdens that we sometimes don't realize we're carrying, but which weigh us down and don't affect us in a positive way.
Okay, thanks.
As students, we face a lot of pressures. I believe that if we aren't careful, we could easily develop an anxiety disorder.
Okay.
Yes, I think it will be an anxiety disorder because I am very impatient person and I live under constant stress and as well as drinking a lot of coffee.
Okay, was interesting. And finally, we have our last item. What is message would you like to leave with the people watching?
For the professionals from different fields listening to this, my reflection is that we must break the stigma that mental illness only happens to those with a specific genetic backgrounds. It can happen to anyone. We need to remember that mental health is everyone's business.
Okay.
Okay, my message to these people is that mental health is very important and must not be ignored. Asking for help is fine and isn't a bad thing. We also shouldn't judge people going through this, but rather try to understand and support them because anyone can be affected by mental health issues, and it really isn't something to be ashamed of. On the contrary, we should face it with strength so we can get through these situations.
Okay.
I want to tell you that asking for help is not a sick, is weakness. It is a way of showing self-love and self-care.
Okay, thank you of your answers. And as haha bonus, we have a special guest, a psychologist, who will talk about the topics we're discussing today.
Hi, Doc. Hi. What's your name? Valeria.
We have a question for you. What has been your experience of the area mental health?
Okay. First of all, hi. My name is Valeria. I'm the psychologist of here of the Campo Nuevo Hospital. And it's a great question. If I can say what have been experience of mental health, I would say maybe some challenges because we have a lot of medical condition here, kind of schizophrenia, affective disorder, and others condition of mental health. But if I can say one question, one word, answer your question, I can say maybe it's a grateful experience. Mental health is so important, and I think sometimes it can be challenged and difficult, but it's a grateful experience, and it's fantastic if you can have a contact with this kind of experience, conditions, and yes, I can say maybe that challenges, but so grateful for this experience. Okay, thank you. You're welcome.